I had no quality of life. The pain was so bad that I couldn't even hardly walk.
Like many people, Jim White suffered through back pain until he could no longer live with it.
The most important thing is that we have a lot of people that are cared for here with problems like this. And as a result of that, we're very used to dealing with patients with spine problems, and that makes it easier for us to do a good job.
Dr. Dean Martz is one of the highly dedicated neurosurgeons on staff who deals with spinal problems.
Inland Neurosurgery and Spine is a group that has been working in Spokane for decades. We have 6 surgeons total, 5 neurosurgeons and 1 orthopedic spine surgeon, and all of us take care of people with back and neck problems.
You hear horror stories, and in fact, the last neurosurgeon that I talked to a couple of years ago explained that it was really a very, very tough surgery. You have a lot of surgery, a lot of pins and bushings and rods and screws and all this kind of stuff, and he just basically scared the heck out of us.
I think all of us try to keep the surgery as limited as possible, and by doing that, the recovery is a little bit easier because obviously with a more limited operation, people will improve more quickly.
He put us at ease. He was so relaxed and so positive about what the outcome would be that we were really pleased to do it.
Jim's initial fears were subsided with the approach taken by the Inland Neurosurgery and Spine team.
When you're doing surgery, sometimes you need to make a large opening to do an extensive operation, but when you can do the surgery with a small opening, that is always much better. And this is where our technology really comes in handy.
It's these kinds of advanced technologies that set Sacred Heart's spinal program apart from the rest.
When we are doing fusions, which sometimes involves putting screws in the spine, rather than make a big operation and a big opening and see every available piece of bone in the spine, we now do the operations through smaller openings and use X-ray machines to help us guide the screws into the right place. One particular machine is called the O-arm, which is a mobile CAT scanner, and Sacred Heart is the only hospital in the area to have one of these. This shows us a picture of the spine in 3 dimensions and makes it extremely safe to put screws into the spine. The O-arm allows you to see the cylinder completely. Once we have that, then we use special instruments and image guidance technology that let us feed the screw perfectly down through the center of the cylinder. By using our technology effectively, we can keep the incisions smaller and make the recovery go easier.
Recuperation time was very, very good. Within 5 weeks, I was walking a mile, and that gradually increased, whereas now I'm walking about 4.5 miles.
Once someone comes to the hospital, they're in an environment where they're going to be well cared for because we do a lot of operations of this kind here all the time, and I think that makes it easier for people to recover quickly while they're in the hospital and get their recovery at home started out on the right foot.
I have no problem telling anybody, don't live with the pain, get it done.